Hello everyone, today we'll be looking at REMS of the hip. REMS, R-E-M-S, stands for Regional Examination of the Musculoskeletal System, and today we'll be looking at the hip. So for this document, it is made by Arthritis Research UK, and it's a really useful document for medical students who want to learn physical examination of the musculoskeletal system. I'll put a link to this document down in the description below. In REMS, like any other REMS, we're going to do in the sequence of look, feel, move, and function tests. So I'm going to read through all of this first. Look, feel, move, function test up until here, and then I'm gonna try and summarize all this so that in a way that is easier to remember. If you'd like to see me reading through all of this and interpreting what it means, feel free to do so. If you'd like to skip to the part where I summarize, I'll put a link, I'll put a timeline in the description below. Alright, so let's start. Examination of the hip. Look. With the patient standing, assess for muscle wasting, gluteal muscle bulk in particular. With the patient lying flat and face up, observe the legs comparing one side with the other. Is there an obvious flexion deformity of the hip? Right. So with the patient standing, you look at the butt first. Gluteal means the butt muscle, gluteal muscle bulk, when the patient is lying flat, you can see if one of the legs are raised. If one of the legs are raised, it's a fixed flexion deformity. Let's see if I can find a picture of it. Of the hip, right. Yeah. There's no picture of a real life person lying down with fixed flexion deformity. Anyway, fixed flexion deformity means that the hip is fixed in flexion. It cannot extend the hip joint. Right, the hip joint is right over here, so it can only be fixed at flexion. This is a really severe case already, I think. So we fixed in flexion. If it's severe, you can see that one of the legs are being raised or the hip is uneven. So you can see that. Right. What else do you look for? If there's a suggestion of leg length disparity, assess true leg lengths using tape measure. Measurements are taken from the anterior superior iliac crest to the medial malleolus of the ankle on the same side. So this is true leg length. Compare the measurements. In a fractured neck of femur, the leg is shortened and externally rotated. Let's see. Check for scars overlying the hip. Scars. Right, so look for gluteal muscle wasting and then ask them to lie down, and then when they're lying down flat, compare the legs, see if there's any obvious fixed flexion deformity, if there's a leg length disparity or one of the feet are facing outwards. So leg is shortened and externally rotated. That's why the feet will be, one of the foot will be facing outwards and one of the legs appear shorter. It's in fracture neck of femur. Let's have 4 scars. Okay, next we move on to feel. Look, feel, move. Feel, palpate over the greater trochanter for tenderness. So where are you supposed to palpate exactly? C-H-A-N. Palpate over the greater trochanter. So the greater trochanter is over here. So you're gonna palpate over this side of the hip. See if there's any pain over there. Trochanter. Palpate this part here. Next, we go on to move. With the knee flexed at 90 degrees, assess full hip flexion, comparing one side with the other and watching the patient's face for signs of pain. If they are in pain, they'll show a grimace. Assess for a fixed flexion deformity of the hip by performing Thomas's test. Keep one hand under the patient's back to ensure that normal lumbar lordosis is removed. Fully flex one hip and observe the opposite leg. See figure 13. It looks like this. So put one hand under the lumbar spine and then push one leg upwards, flex it fully and observe the other leg. See if it raises above the bed. Right, where were we? Fully flex one hip and observe the opposite leg. If it lifts off the couch, then there is a fixed flexion deformity in that hip. As the pelvis is forced to tilt, a normal hip would extend, allowing the leg to remain on the couch. So Thomas test, if it's positive, it will indicate fixed flexion deformity of the leg, of the hip. So let's say you're doing on the right leg. You put your hand on the spine, under the lumbar spine, and you push the right leg up as high as you can, and then you look at the left leg. So you're assessing the left leg at this time. If the left leg lifts above the bed, it will mean that the hip is unable to extend to keep the leg above on the couch. So the leg will be raised. And this indicates fixed flexion deformity of the left leg. Right. So Thomas test, flex. With the hip and knee flexed at 90 degrees, assess internal and external rotation of both hips. This is often limited in hip disease. Right. And then assess the hip and proximal gluteal muscle strength. Assess the hip and proximal gluteal muscle strength by performing the Trendelenburg Test. This involves the patient alternately standing on each leg alone. In the negative test, the pelvis remains level or even rises. In an abnormal test, the pelvis will dip on the contralateral side. Right. I think based on the principles that I've read earlier in this document, we do everything where the patient is standing first before asking them to go to the couch, so they don't have to sit and stand so frequently. So I would do this first before doing all the ones where the patient is lying down. Okay, so I'll rearrange it a little bit in the summary. So function. Done look, feel, move, and now we're going on to function. Ask the patient to walk. Look for an antalgic or Trendelenburg gait. An antalgic gait simply means a painful gait, normally resulting in a limp. A Trendelenburg gait results from proximal muscle weakness and commonly results in a waddling walk. Right. So I think I'll show you what Trendelenburg gait looks like so that it will remain in your head. Trendelenburg. Trendelenburg gait. I think one of them did, yeah, I think this guy did quite a good demonstration of Trendelenburg's gait. Let's look at it. If you can see, the hip drops to one side. This is Trendelenburg's gait. Let's see if there's another video. This guy. Yep. So there's a problem with the abductors. That's Trendelenburg's gait. Okay. Proximal muscle weakness. Proximal muscle. We will drop. Yep, a problem with the abductors. No. Proximal muscle weakness. Never mind. Okay. Let's get back on track. Examination of the hip, look, feel, move, functional test. So functional test, you only ask them to walk. You're gonna observe if there's any antalgic gait or any Trendelenburg gait or any other gait. Right. So let's try to summarize examination of the hip. Look, with the patient standing, assess for muscle wasting, gluteal muscle bulk. So you're gonna look from the back so that you can see the butt muscles. With the patient lying flat and face up, observe the legs. So don't ask them to lie flat first. We're gonna do the ones that the patient can do while standing first. So while the patient is standing, you're gonna inspect first. You're gonna inspect from the back and look for the gluteal muscle bulk. And then you're gonna ask them to raise one leg, stand on one leg, and see if the hip falls or remains level or raises. If it raises or remains level, it's normal, and if it falls, it's a positive Trendelenburg test. So you assess the Trendelenburg test. First you observe, then ask them to stand on one leg each at a time, taking turns, and then ask them to walk. That's your function. So you cover all this in the first part when the patient is still weight bearing. Okay, then we ask the patient to lie flat on the couch. Okay, and then we observe if there's any obvious flexion deformity, or if one of the legs, one of the feet are externally rotated, one of the legs are externally rotated, or if one of the legs looks shorter. We're going to measure the true length, which is from the anterior superior iliac spine to the medial malleolus of the same leg, and compare both sides. So one of the legs will be shorter and externally rotated in fractured neck of femur. Next, we're going to check for scars. So look, feel, move. Look first, you're going to look for butt muscle bulk, and then you're going to ask them to stand on one leg, each taking turn. Stand on left leg first, then stand on right leg, doing a Trendelenburg test, and ask the patient to walk, looking for antalgic or Trendelenburg gait. And then you're going to ask them to lie down, and you're going to see if there's any obvious flexion deformity or obvious difference in the length of the legs or externally rotated leg, which might indicate a fractured neck of femur. And then you're going to measure the length of the leg, true length of the leg, from the anterior superior iliac spine to the medial malleolus of the same leg, comparing to both legs. Now, after look, you're going to feel, palpate over the greater trochanter for tenderness. Okay, next move. With the knee flex at 90 degrees, assess full hip flexion, comparing one side with the other and watching the patient's face for sign of pain. So flex the knee, full hip flexion. Oh, okay. The knee flex at 90 degrees, assess full hip flexion. Right, try and push the hip as high as you can. So next you're gonna do the fixed flexion deformity test, which is known as the Thomas test. And then with the hip and knee flexed at 90 degrees, assess internal rotation. Okay, so flexion, then Thomas test, and then internal and external rotation of the hip, and Trendelenburg test we've done, function test we've also done. Okay, so recap, summary, look, feel, move, function test, examination of the hip, REMS. Look, ask the patient to stand, look from behind, check the gluteal muscle, and then you're gonna do the Trendelenburg test over here. So ask them to stand on one leg, stand on the right leg, and stand on the left leg, and then ask them to walk, look for any abnormal gait. Then you're gonna ask them to lie down, see if there's any obvious deformity of the hip, any obvious fixed flexion, or any obvious disparity in the length, or any obvious externally rotated leg, which might indicate fractured neck of femur, and any scars as usual. And then after look, you feel over the greater trochanter for tenderness, and move. You're gonna assess full flexion, and then do a Thomas test, and then hip internal rotation and external rotation. And that's the end of the examination. I think that's all I have for you. Thanks for watching. Bye bye.